Hey everyone, welcome back to all my listeners. This is episode 17 in season 16. Today is Wednesday, December 24th, 2025. My name is Sonal Patel, and this is the Paint the Medical Picture podcast series. All right, you guys. So, this is going to be the last episode of the month. I know it's Christmas Eve. I know there's still another week left in the month, but I am taking some much needed time away from podcasting, regrouping and planning for another fantastic season. Season 17 is what I'm going to be starting up in the month of February. So make sure you guys stay tuned, listen to all of my 5 years worth of podcasts. I've got playlists that are set up on my YouTube channel for Paint the Medical Picture Podcast. You can find the website for Paint the Medical Picture Podcast directly, play back all of the episodes that are pertinent to your practices, to your organizations, and to your entities. So today is going to be the last episode that is, of course, going to feature my newsworthy fraud, waste, and abuse highlights for the month of December. And of course, I'm going to spotlight some of those from the month's criminal and civil enforcement cases that I find newsworthy. And in my trusty tip, the last trusty tip of this month, I'm going to be focusing on evaluation and management services for the podiatry specialty, including the big bad boy Modifier 25. And I'm going to go ahead and close out and round out today's episode with another remarkable quote on resilience by Winston Churchill. All right, you guys, let's get into it. So in today's newsworthy, the month's fraud, waste, and abuse cases. As of the recording of this episode, a few days before Christmas Eve, December has already seen 52 cases, whopping 52 cases as of the recording of this episode. So let's go ahead and check out some of the cases that I want to spotlight. December saw the largest North Carolina behavioral health practice agreeing to pay $1.9 million to resolve allegedly false Medicare claims. MindPath Care Centers, North Carolina, PLLC, is North Carolina's largest behavioral health practice with offices stateswide, along with 3 former officers who paid $1.9 million to the United States to resolve allegedly false Medicare claims billed for psychotherapy and related services. This particular settlement arose from whistleblower allegations that MindPath fraudulently billed for psychotherapy and medication management sessions. The United States filed a complaint alleging that the defendants, quote, systematically billed for fraudulent psychotherapy treatments without required documentation of the separate time and psychotherapy treatments of patients to maximize their profits, all in blatant disregard of Medicare billing requirements, end quote. More specifically, the government alleged that from the years 2018 through 2020, MindPath billed Medicare without providing documentation of separate and distinct psychotherapy treatments, failed to adequately correct problems repeatedly raised by MindPath employees, and, quote, demonstrated a pattern of reckless disregard or deliberate ignorance toward stated concerns about billing fraud, end quote, while being, quote, primarily focused on generating income, end quote. Ultimately, MindPath agreed to pay $1.9 million to resolve these False Claims Act allegations. The False Claims Act mandates that the government recover triple the money falsely obtained, plus substantial penalties for each false claim submitted, and attorney's fees and costs to the whistleblower. The civil claims resolved by the settlement here are allegations only, with no judicial determination or admission of liability. The defendants deny these allegations. December also saw a Virginia laboratory agreeing to pay $758,000 to settle allegations of kickbacks to doctors and marketers. Clinical laboratory Next Bioresearch Services, LLC, doing business as Next Molecular Analytics, has agreed to pay at least $758,000 to the United States to resolve False Claims Act allegations involving illegal kickbacks to doctors and marketers. Next has agreed to cooperate with the Department of Justice's investigations of and litigation against other participants in the alleged schemes. The anti-kickback statute prohibits offering, paying, soliciting, or receiving remuneration to induce referrals of items or services covered by Medicare, Medicaid, and other federally funded healthcare programs. It is intended to ensure that medical providers' judgments are not compromised by improper financial incentives and are instead based on the best interests of their patients. Under the settlement with the United States, Next has agreed to pay $758,000 plus additional amounts if certain financial contingencies occur. The settlement resolves allegations that Next knowingly and willfully paid kickbacks to induce laboratory testing referrals. Next allegedly paid doctors in Texas and Arkansas thousands of dollars in kickbacks, which were disguised as consulting fees and medical director fees, but actually were offered to induce the doctor to order Next laboratory tests. Next also allegedly paid commissions based on the volume and the value of referrals to certain independent contractor markets to arrange for and recommend that doctors order Next laboratory tests. The settlement resolves allegations that Next billed Medicare, Medicaid, and TRICARE for the laboratory tests despite knowing of these kickbacks. The settlement resolves certain allegations in a lawsuit originally filed by two private parties under the whistleblower provisions of the False Claims Act, which permit private parties to sue on behalf of the government and receive a share of any recovery. The relators will receive $113,700 of the proceeds from the settlement. The claims resolved by the settlements are allegations only, and there has been no determination of liability. December also saw Recovery Centers of America agreeing to pay $2 million to resolve allegations that it violated the Controlled Substances Act and the False Claims Act by mishandling controlled substances and providing inadequate treatment services. Recovery Centers of America has agreed to pay $1 million to resolve allegations that it failed to comply with provisions of the Controlled Substances Act, the CSA, that are designed to prevent the diversion of controlled substances for illegal uses, and an additional $1 million to resolve allegations that it violated the False Claims Act, the FCA, by billing the government for drug and alcohol treatment services that it failed to adequately provide. The United States allegations under the CSA arise from audits and investigations the Drug Enforcement Administration, the DEA, conducted at RCA facilities in Pennsylvania and Maryland between the years 2019 and 2024. Based on those audits and investigations, the United States contends that RCA dispensed controlled substances in an unlawful manner, that certain controlled substances were missing from the company's records, and that the company failed to comply with additional record-keeping requirements of the CSA. In addition, the United States alleges that at certain facilities during a period from 2017 through 2019, RCA violated the FCA by billing the Federal Employees Health Benefits Program and Medicaid for the care of beneficiaries to whom it failed to provide and document the requisite treatment services. The settlement resolves a lawsuit filed under the whistleblower provisions of the False Claims Act, which permit private parties to sue on behalf of the government when they believe that a defendant has submitted false claims for government funds and receive a share of any recovery. The settlement in this case provides for the whistleblower, a former outcome supervisor at RCA's corporate headquarters in King of Prussia, Pennsylvania, to receive a $230,000 share of the settlement amount. The claims resolved by the settlement are allegations only. There has been no determination of liability. December also saw a telehealth company agreeing to pay $300,000 to resolve False Claims Act allegations. The U.S. Attorney's Office for the District of New Hampshire has entered into a settlement agreement with LifeWorks Counseling Associates, PLLC, and its owner, where they will pay $300,000 to resolve allegations that they violated the False Claims Act by improperly billing Medicaid for services provided by an individual excluded from the Medicaid program. No program payments may be made for services furnished by an individual excluded by the U.S. Department of Health and Human Services, the Office of Inspector General, the HHSOIG. The HHS-OIG has advised healthcare providers to check the list of excluded individuals or entities on the HHS-OIG website in order to avoid potential liability. LifeWorks is a telehealth mental health provider based in New Hampshire. The United States contended that the owner and LifeWorks submitted claims and received reimbursement from Medicaid for services provided by a man who was excluded from federal health care programs by HHS-OIG at the time such services were provided, which were therefore not reimbursable. To resolve their liability, the owner and his company will pay $300,000. The settlement amount is based on their ability to pay. LifeWorks and the owner fully cooperated in the parallel criminal investigation. There was no admission of liability. December also saw a wound graft company owners sentenced for a $1.2 billion healthcare fraud and agreed to pay $309 million to resolve civil liability under the False Claims Act. In the first prosecution of its kind, the owners of several Arizona wound graft companies were sentenced to significant terms of incarceration for causing over $1.2 billion of false and fraudulent claims to be submitted to Medicare and other health insurance programs for medically unnecessary wound grafts that were ordered as a result of illegal kickbacks and applied to elderly and terminally ill patients. A woman was sentenced to 15.5 years in prison, and her husband was sentenced to 14 years in prison. According to court documents, the husband and wife pair orchestrated a large-scale wound care scheme from the years 2022 through 2024. The woman solely owned and operated two companies that contracted with medically untrained sales representatives to find elderly Medicare beneficiaries throughout Arizona with wounds of any kind. Once the sales representatives identified these patients, many of whom were in hospice care, she directed the sales representatives to order expensive bioengineered skin substitutes, amniotic membrane allografts made from human placental tissue, to be placed on the wounds. To maximize profits, she required the sales representatives to order only the largest sizes of grafts available, even if the sizes of grafts or the use of grafts as treatment were not medically appropriate or reasonable. She referred the patients identified by the sales representatives first to a company she owned, and later in the scheme to a company co-owned by her husband. Both of these companies were enrolled as Medicare providers and could submit claims to Medicare. Through these companies, the pair purchased the grafts from a wholesale graft distributor. They also contracted with nurse practitioners to apply the grafts and billed Medicare and other health insurers for the grafts applied. The pair instructed the nurse practitioners to suspend their medical judgment and apply whatever quantities and sizes of grafts were ordered by the medically untrained sales representatives, regardless of medical necessity. Through the three companies she owned, the woman received over $279 million in illegal kickbacks from the wholesale graft distributor in exchange for ordering its grafts, over $100 million of which she diverted to her personal accounts, and tens of millions of which she used to pay illegal kickbacks to the sales representatives. The company co-owned by the husband received an additional $130 million in illegal kickbacks from the same graft distributor. The financial incentive for the sales representatives to order large numbers and sizes of allografts, combined with the pair's requirement that nurse practitioners apply all grafts ordered, resulted in large grafts applied to small wounds, several grafts applied to single wounds, grafts applied to non-existent wounds, and grafts applied to terminally ill patients receiving palliative care, some of whom died within days or the same day of the allograft application. Over the course of just 18 months, from November 2022 through May 2024, the couple and their co-conspirators submitted approximately $1.2 billion in false and fraudulent claims to health insurance programs, including over $960 million to the federal health care programs Medicare, TRICARE, which is the Organization for the Healthcare Program for U.S. Service Members and Their Families, and the CHAMP VA, which is the healthcare program for spouses and children of permanently disabled veterans. The federal and commercial healthcare programs collectively paid over $614 million based on these claims. The government seized substantial assets that the pair accumulated from this scheme, including $97 million from 28 bank accounts at 7 financial institutions, 3 life insurance annuities exceeding $21 million, 4 luxury vehicles, including a Ferrari 488 Spider convertible, a Mercedes-Benz AMG Roadster, a Mercedes-Benz 4x4 squared G-Wagon, and a Mercedes-Benz GLE, collectively purchased for over $988,000. They also obtained $367,150 in cash recovered from the couple's home and safe deposit boxes, and over $348,000 worth of gold and silver bars and coins. The pair pleaded guilty to conspiracy to commit healthcare fraud and wire fraud on October 24th, 2024, and on January 31st, 2025, respectively. In addition to the terms of incarceration, the duo were ordered to pay restitution and to forfeit fraudulent proceeds obtained personally and through companies they owned and controlled. The woman was ordered to pay over $614 million in restitution and to forfeit over $279 million in fraudulent proceeds, while the man was ordered to pay over $605 million in restitution and to forfeit over $130 million in fraudulent proceeds. In addition to the criminal case, the woman and the wound graft marketing company she owned, Apex Medical LLC, agreed to pay over $279 million, and the man agreed to pay $30 million related to their respective civil liability under the False Claims Act, resolving allegations that they knowingly submitted false claims to Medicare and other federal healthcare programs for medically unnecessary wound allografts, received illegal kickbacks from a wholesale wound allograft distributor in exchange for orders, purchases, and referrals, and paid illegal kickbacks to other parties. The federal anti-kickback statute prohibits offering or paying anything of value to induce referrals of items or services covered by Medicare and other federally funded programs. The statute is intended to ensure that the judgment of medical providers is not compromised by improper financial incentives. The False Claims Act allegations resolved by the civil settlements were originally brought by whistleblowers under the qui tam provisions of the False Claims Act, which allow private parties to bring suit on behalf of the government and to share in any recovery. The matters remain under seal while the investigation of other parties continues. The amount of the whistleblower shares of the settlements has not yet been determined. And finally, December saw a medical biller charged with diverting opioids and federal health care fraud. A federal grand jury in Wilmington, Delaware, returned an indictment charging a South Dakota man with ordering thousands of opioid pills by stealing the identity of medical professionals with whom he worked. The grand jury also charged him with healthcare fraud for causing fraudulent submissions to Medicaid and a private health insurer. According to court documents, the man worked as a medical biller and credentialing professional, where he helped medical professionals and organizations contract with health insurers, including Medicaid, and helped medical providers bill those insurers for services. Through that business, he gained access to the professional licensure information for medical professionals. He used that access and the name and licensure information of medical professionals to order himself thousands of opioid pills through wholesale pharmaceutical suppliers and prescribe himself opioids. He did that without the approval or the knowledge of the medical professionals whose name and licensure information he used. He also used his access to his own electronic medical records to falsify his own personal health records. He used those falsified health records and additional forged medical documents to present as a cancer patient requiring pain management services. Based on those false representations, he was treated by a pain management doctor and caused his private health insurer to pay for those services. Those services included the installation of an intrathecal pain pump and the prescription of opioids, all done based on the biller's forged medical records. He also represented himself as a certified health professional to those with whom he worked, At different times, he falsely represented himself as a licensed nurse. He also obtained a medical assistant certification by fraud. Based on those false representations, he convinced a nurse practitioner to allow him to perform transcranial magnetic stimulation therapy on patients. He also represented to patients that he was a nurse. He then submitted false claims to Medicaid for reimbursement for performing transcranial magnetic stimulation therapy. The biller is charged with 13 counts of aggravated identity theft, 2 counts of healthcare fraud, and 7 counts of obtaining drugs by fraud. If he is ultimately convicted, a federal district court judge will determine any sentence after considering the U.S. sentencing guidelines and other statutory factors. An indictment is merely an allegation, and all defendants are presumed innocent until proven guilty beyond a reasonable doubt in a court of law. And now it's time for my best practice tips in Trusty Tip. Of course, my Trusty Tips have gone over evaluation and management services, including Modifier 25 over these years. But today I wanted to talk about another specialty, podiatry, that is being targeted for misunderstanding of the appropriate use of Modifier 25, as well as documentation that is needed to support evaluation and management services. Remember the fun fact that I've talked about from time to time over these years on the podcast. The OIG conducted an analysis on evaluation and management services over 15 years ago. And in a 2010 released OIG report that found that Medicare inappropriately paid $6.7 billion for E&M claims that were incorrectly coded or were insufficiently documented. So that report came out over 15 years ago. And in 2010, they disclosed that documentation that they reviewed, that their contractors, their reviewers looked at, the documentation was insufficient and or the evaluation and management codes were incorrect. Perhaps they were overcoded, perhaps they were undercoded. Regardless, they were incorrectly coded. Now, the OIG just released a new report titled Podiatrists' Claims for Evaluation and Management Services Did Not Comply with Medicare Requirements. So here we go. It's 15 years later. It's December 2025. And this specialty of providers called podiatrists, their E&M services were not meeting Medicare requirements. So we're in the same predicament here 15 years later. And be mindful, the audit span, which I will talk about here in a second, was from 2019. That was the audit universe. So again, before our new E&M guidelines that happened in 2021 and 2023. So we're still looking at the old 1995 and 1997 guidelines during this audit period for this particular report. So the why was this report actually conducted? Well, the OIG states in their report that they conducted this audit to determine whether these compliance issues existed for payments to podiatrists for their evaluation and management services performed from January 1st through December 31st of 2019. So that was one full year that they conducted, and this was known as their audit period. Now, this audit examined whether podiatrist claims for E&M services billed with Modifier 25, which indicates that an E&M service was significant and separately identifiable from another procedure or service performed on the same day, to see if all of that complied with Medicare requirements. So again, we've talked about this over the podcast for a number of years. The justification that is needed to support the documentation, as well as the documentation that is required to support that significant and separately identifiable E&M service on the same day with another podiatry service. So the report goes into copious details, but I just wanted to touch on a few highlights in the podcast. So let me move on. So the findings from this report. The OIG states that during their audit period, CMS's oversight may not have been sufficient to prevent improper payments. On the basis of their sample results, the OIG estimated that of the $222.5 million paid by Medicare during their audit period, approximately $39.6 million did not comply with Medicare requirements. So again, the OIG is the government watchdog, right? Their job is to ensure that the Medicare monies are protected. So their analysis points out that CMS may have had some deficiencies. They were not providing good oversight to this specialty of providers, the podiatrists, for providing much needed education for the multiple requirements back in 2019 for what documentation is needed to support those evaluation and management codes, as well as what is needed to show in documentation that a separate E&M service was done to include and append the Modifier 25. So they recommended, the OIG recommended that the CMS works with their MACs, their Medicare administrative contractors, right? All of those throughout the country to determine whether additional oversight, and that could include guidance, that could include education, that could include medical reviews and or provider internal audits, right? To see what is necessary to prevent improper payments associated with the podiatrist billing of E&M services with Modifier 25. All of that estimated to a overpayment of around $39.5 million during that audit period. So those were the recommendations, is that CMS could do a better job in terms of instructing their MACs to provide all of these additional oversight mechanisms, right? Which they're very good at for other specialties. They're trying to pinpoint here podiatry specialists need assistance as well in terms of extra guidance, extra education, medical reviews, and even internal provider audits. Now, from my analysis of reading the entire 19-page report, it's clear to me that there's much room for improvement in understanding when Modifier 25 would be considered appropriate, because in this recent OIG report, they found that only 56% of podiatrists' E&M claims billed with Modifier 25 were to be in compliance with Medicare requirements. So that's a very small number, 56%. So that means that improper payments were made in 44% of the audited claims. So that's a high number, right, of error. Only half, just a little over half of claims were billed correctly with the Modifier 25, and the E&M and everything was squared away appropriately. But then, 44% were found to be in error, and their findings included, again, insufficient documentation or incorrect coding, and of course, Modifier 25 is not supported. So all three of those buckets are definitely stressed in the entire report. But I wanted to just talk about a detailed snip from the report that I wanted to read to my audience, specifically for the Modifier 25. And the OIG report highlights services were not significant and separately identifiable. The OIG report states that, quote, payment must not be made to a podiatrist for an item or a service unless there has been furnished such information as may be necessary in order to determine the amounts due such provider. An E&M service provided on the same day as another service is not covered unless the E&M service is significant and separately identifiable. And that is based on their resource, the 2019 AMA CPT Codebook, Evaluation and Management Services Guidelines. The report continues, Modifier 25 indicates that a significant, separately identifiable E&M service was performed by the same physician or other qualified healthcare professional on the same day of the procedure or other service. And their resource there is the National Correct Coding Initiative Policy Manual, Chapter 1. The OIG report continues, for 5 sampled claims billed with Modifier 25, the E&M services were not significant and separately identifiable. Specifically, the independent medical review contractor determined that the information in each enrollee's medical records did not support that the E&M service billed was not related to other podiatry services performed on the same day. So basically, that independent medical review contractor did not find anything significant and separately identifiable from the minor procedure that was billed on the same day as the evaluation and management services. So our podiatrists have to be very, very mindful and make sure that documentation carves out very neatly that there is, in fact, a separate and significant evaluation and management service for that particular patient on that particular day that they are seeing the podiatrist. So the report goes on and provides a example of an E&M service that was not significant and separately identifiable. And they provide a snippet from a 71-year-old enrollee that was seen by the podiatrist for a follow-up wound care to a previous debridement, reducing the thickness. That's what a debridement means. They're scraping down, reducing a thickness of a diabetic ulcer on the left foot. And so again, as that medical reviewer reviewed details, they could not find anything significant and separate for that E&M alongside that debridement service that was done on the same day. And again, that is with that CPT code 97597 for the ulcer debridement. And again, that was paid for. So the OIG report discloses that we paid the debridement for the ulcer, and we also paid for that E&M service with the Modifier 25. But upon further review of documentation, they believe that that E&M service is going to be a overpayment. So they're requesting that $62 comes back to the CMS program, right? And so they go into all of those details as well, and that MACs should go out and, utilize their recovery audit contractors to recoup monies like that they've identified based on this small sample of 100 claims that they reviewed for this particular OIG audit. But I thought this was a fantastic report that I should include in my Trusty tip for my final Trusty tip in the month of December. This is really, really useful information, especially to those in my audience who work in the podiatry specialty. So take a better look, internally spot check and audit your claims that are all about evaluation and management services alongside a minor procedure, and you're trying to append a Modifier 25 on that E&M service. You have to make sure that that E&M is significant and separate from that minor procedure. And finally, I focus season 16 Spark on resilience. I want this 16th season Spark to be filled with our world's thought leaders, writers, artists, philosophers, everyone whose words provide us with their insights on resilience. So in this week's inspiring quote in Spark is from Winston Churchill. This is no time for ease and comfort. It is time to dare and endure. So very true, right? With the new year just around the corner, take time to take stock of all your wisdom gained after every downfall. Take time to list all of your accomplishments over the years. You know you are ready for more. Your time has come to start soaring to new heights. I'm happy Winston Churchill's spark still burns brightly and can continue to inspire so very many. All right, you guys, that wraps up today's episode. Now, I know it's Christmas Eve. I know you guys are wrapping up your work day. Maybe you've had to work a few hours today. So I really hope you finish up and wrap up those Christmas presents, put them under the tree, and just start decompressing. Start waiting for Santa, waiting for those reindeer to come, all those reindeer bells, right? Jingling. Make those cookies for Santa, provide that glass of milk and carrot sticks for those reindeers. I know I used to do that when my son was very small. It was such a joy. I love the amazement that our children see, right, with their wonder that Santa is still coming. And it's Christmas Eve and they wait up for hours and hours and hours, and you find them on the couch passed out waiting for Santa, right? But they magically never see Santa, but all those gifts appear, and I love their eyes filled with wonder. So I wish you all a very, very happy Christmas tomorrow. Wishing you a very happy Kwanzaa as well, and wishing you all the very, very best for 2026. Thank you all so much for all of your support over this entire year of 2025. My worldwide audience of just knocking on 90 countries. I am so amazed that so many of you tune in and listen to everything I talk about in healthcare, as well as my inspirations. I am grateful to all of you that continue to allow this podcast to happen. And I can't wait to resume and deliver so much more in 2026. So I wish you guys all the very, very best. Thank you so much for listening on today's episode. And I hope every week with me brings you closer to helping your providers paint a masterpiece. See you in 2026.